Hi there, this is Dr. Gawel from Indian Trail Animal Hospital. Today I'd like to give you a little bit better understanding about cat cardiology. So a cardiomyopathy is defined as a problem within the heart muscles. This can lead to numerous primary as well as secondary heart conditions. So we see things like leaky valves or thickening of the heart muscle. These can be primary heart conditions that affect our cats. Secondary problems would be things like other underlying diseases causing the heart problems. For example, kidney disease can cause hypertension or high blood pressure. Thyroid problems can also cause hypertension, as well as thickening of the muscles and enlargement of the heart. Cats are notorious for hiding clinical disease, so it may not always be apparent that there's a problem, a heart problem going on with your cat. What kind of signs or subtle signs can we look for? Well, it may be start with social cues. Is their attitude different? Are they more withdrawn? Do they not come and greet you and see you? Do they seem lethargic, depressed, or very weak? Breathing pattern changes are key. Are you seeing harder or heavier breaths? What we would term abdominal pressing. So their stomach is going in and out very hard when they're trying to take their breaths. In some of the more extreme and serious cases with heart disease in cats, we can see paralysis or weakness in the back legs, extreme pain in those back legs, and then what you may have also heard, sudden death, which is caused by a cat heart attack. So how can we help avoid these problems? Well, we're always going to recommend having an annual physical examination. That allows us to listen to the heart and lungs, listen for abnormal beats, listen for heart murmurs, feel for pulse changes, and get an overall idea of what the rate is like as well. These can be early indicators that there is a problem with your cat's heart. We're going to talk to you about history, go over some of those subtle signs as well. Using these two different tools in history, we may formulate a plan to work up that heart. So how are we going to do that? Start with things like a radiograph or an x-ray. That's going to evaluate the structures inside the heart. Look for changes in the heart size, changes with the lungs, and as well as those associated structures around the heart. An ECG monitors the electrical activity of the heart. Gives us an idea what the rhythm and rate is doing. Is there any changes to chamber sizes? And lastly, but definitely not least, is checking blood pressures. Hypertension can be one of those early indicators that there is a problem. So based on these results, we may even move towards completing an echocardiogram in your cat. An echocardiogram uses an ultrasound probe to evaluate the inside of the heart and the structures related to the heart. So we will be checking the valve, the muscle, and then also monitoring things like rate and taking specific measurements of that heart to give a diagnosis of the problem as well as a prognosis. This can lead to different types of treatment plans for our cats, whether that involves medication, diet change, or further follow-up and monitoring via blood pressures, radiographs or x-rays, as well as the echocardiogram. Why is this all so important? Well, early intervention is key and critical for helping protect the well-being and longevity of our cats when we're talking about heart disease. Early intervention often leads to slowing the progression of the disease itself, as well as if it's due to an underlying problem, we can help reverse some of those changes to manage the heart disease by treating the underlying health problem. If you have any questions or concerns about cat cardiology, please give us a call at Indian Trail Animal Hospital today.